It's time for us to talk wellness on Wake Up Nigeria. This morning we have Bukola Essien in the studio with us. She's going to be discussing the importance of emergency services at events. And it's such a pleasure as always to have you in the studio.
Same here. It's always
Thank you
a
so
pleasure
much
to be here.
So, and you came with a first aid box.
Oh, yes, I did.
Yeah.
I came with a first aid box today.
Before we start perusing the contents of that first aid box, let's talk about that question. What exactly is the importance of first aid or even of emergency services at events?
All right. Emergencies don't announce, like I would always say, that we're going to happen. So first aid at at events is trying to save a life or help a situation before it gets out of hand. So you don't have to wait for it to escalate or get really worse. You can actually save a life and then try to nip and, how will I put it now?
Nip the problem in the bud before it gets worse.
Before it gets worse. So first aid is very important. You cannot overemphasize it because it has to do with life. It has to do with health. It has to do with, you know, saving a life is a lot. So you cannot even trade that with money. You can't even do that. So first aid is very important at any event you can, especially when you have a lot of humans.
Bukola is very passionate about emergency services at events, and in fact, she also has an outfit that caters to emergency services at events. Now, talking about the first aid box, let's take a look at what's in this box. Okay. So yes, we have a first aid box in front of us.
It looks like a treasure box, actually. All right.
And this would be very, very, very helpful for those who are wondering at the importance. So let's talk about
here we have an inhaler.
An inhaler.
All right.
An inhaler. Yeah. I mean, that is so obvious. Yet I'm like.
Yes, we have an inhaler. But the truth is that your first aid box, the content of your first aid box is determined by where you want to use it. All right. You might not need some content here because of where you're going. Like if I'm going to a kiddies event, there are some certain things that might not be here. If I'm going to be using it at a gym, there are some certain things that should be here. You know,
so at a kiddies event, what will be here and what
of course, I would always go with the inhaler because you don't know if a child is having a respiratory, you know, challenge or anything. All right. Then we'll also have what we call the peroxide.
Okay, because children get injured.
Yes, because they could just fall off, and then we have the peroxide.
Okay.
All right. We also.
So I'm very curious, what items here right now would not be at a children's event? Because I think there are other adults at the event as well.
Yes, it depends on who we have been asked to, you know, take care of. But of course, because we are health and life conscious, and we are about saving lives. Would always go with a lot of it. Okay,
so now we're still talking about the content. So we have the cotton wool there.
Yes, we have the cotton wool.
And the bandages.
We have the bandages. Okay. We have the glucose.
Glucose, yes, very important.
We have that. You know, we have
so there's glucose. The glucose, okay.
All right. Then, of course, we have the hand sanitizer before we touch. We have our hand gloves. Okay. So that we wear that before you can touch anyone. All right. The peroxide, like I mentioned before, is there.
The spirit.
A spirit. We also go with something because of the recent happening. This is called a CPR mask. Okay. Okay, for cardiopulmonary resuscitation in case there is someone slumming. And then we need to do a CPR quickly, and then the mouth-to-mouth, you know, what we call the breath of life. We use this.
Oh, so unlike before when you had no choice than to use your mouth
Yes,
directly.
Because exactly.
So how do you use that? I'm very curious. Could you show me? I'm very curious.
All right.
How do you use it?
This is the mask. All right, and so.
Oh, so you insert it in the person's mouth.
Okay, and then your mouth is somewhere here.
Which is good before you get bitten. Okay.
Not just bitten and get infected or anything, you know, because you don't know if someone has TB or something like that. So we use
And this is single use?
Single use, disposable.
Of course.
Once you use, you throw off. Okay. All right, so we have that. We also have ice packs. All right. We have ice packs. Instant cold pack. All right. We have
and it's cold actually.
Yes, so we have that. We also have
there's gauze there.
There's wire gauze.
Yeah.
There's bandages.
Yeah, this is to cover wounds.
Yes, we also have the spirit,
Oh, yeah.
ventilated spirit, which
Yeah.
everybody knows.
I'm very curious about this.
Oh, yes.
Okay. More glucose.
Yes, more glucose, because if you're going to a sporting activity, you need that a lot.
Okay.
You know,
More bandages as
more
well.
bandages. Then we also have the ORS.
You actually carry ORS.
I have
That's
one.
good. That's really good.
Because we
That's
have,
very necessary for children's parties as well.
yes,
Mm.
so that we can take care of things, you know, quickly before it gets out of hand. We have the paracetamol.
Yeah. Very
Alright,
important.
it's very, very important.
Do you
Then
have flagyl as well?
we don't give antibiotics.
You try not to give antibiotics.
Yes, because we are
Okay.
not medical officials. We don't prescribe those, so we just give across-the-counter medications.
Medication. Okay.
You know, so
Okay.
we
Makes a
don't
lot
do
of sense, really.
flagyls. We don't do
Yeah,
antibiotics.
because sometimes there are certain antibiotics that you can't
But
just
of course, we
use.
give antacids for those that
Are
have.
there antacids as well?
Yes, we do. We have antacids
great.
here.
Okay.
We have antacids here.
Okay.
All right.
For
So,
chest-borne.
For chest
and
borne,
all,
depending, like I
indigestion.
said, depending on the event.
Mm.
I might not take an antacid for children's party.
Why?
I might not.
Why?
It's children's party, kiddies
Yeah,
party.
They rarely suffer from indigestion.
Yes, they do. They don't always have that. It is.
Or do you replace that with the syrup version? Is that what you would do sometimes?
Yes, we either go
Suspension.
with suspension,
Mm.
you know, for them.
Okay.
It's better to go with suspension for them.
Okay.
And then, of course, aside this first aid,
Mm-hmm.
we always have water.
Water.
Yes, I had an incident that happened some weeks back.
Okay.
You know the weather has been pretty hot.
Yes.
So this little boy was going to do a presentation. It's actually a school presentation.
Okay.
But good enough, someone quickly noticed that he was actually passing out.
Whoa.
So we just,
Dehydration.
yes, we took him out.
Oh.
He was sweating. So we had to give him water, you know, and free him up. So heat exhaustion and all that. So we always have water on standby. So like I said, depending on, you can't have some of these things in your house. You know, you should have plasters. There are plasters here. I have little scissors here. Okay, we have this thing we use because you don't just this.
Okay.
Okay, so you have the spirit.
Yes, this is for you to put the cotton wool to dip it in. Do you have the
Yes, we
what
have
am I
the
call it
forceps.
now? The forceps.
Yes, we do. So if you can have all these at home, fantastic. If you can have it close to your kitchen
This is
area,
actually not bad to have at home. Yeah.
everyone should have it.
Yes. So
Everyone
you just pick it up
pick
like
it up.
this.
You know, there's
And
already
then
it's already soaked
sometimes
in
people put
ventilated
it's already
spirit.
soaked, okay. Because sometimes if you're in that situation, you just put it down and then put the spirit or whatever, dip
Yes.
it in, then squeeze
But these
it
days
again.
we tend to
We do it
use more of
before.
peroxide
Peroxide.
because
Why?
it kills the bacteria
Faster.
and then
Okay.
prevents further infection.
Infection.
So
Okay.
we can
So
send it.
this is why. So that prevents you having to touch it with your fingers. Just
Yes,
because
yes.
it's not available.
But of course, you're going to be wearing your hand gloves.
Yes, very
All right,
important.
so-
Very important. Especially when you're taking care of someone.
So-
Use your gloves.
First aid is a necessity everywhere. Office area, your home, have a first aid in your car. Anything can happen anywhere.
I grew up with medical professionals, so I took it for granted that people had all these things at home.
All right.
Until much later when I realized that when you talk about some of these things, it sounds foreign to a lot of people. And I'm like, how can you not have ORS at home, for example, or paracetamol, or... But then many people don't even know what these things are, because when you go to the hospital, it's just prescribed for them, and they just take it and they move on. They don't really know what they are called. They don't even know what use some of these items are. So sometimes it doesn't really hurt to ask your doctor or your pharmacist, as the case may be, what something is called, just so you can at least have knowledge of it,
Yes.
especially if a problem arises. So you can say, oh, this is what I used that led to this and all.
Very important to have a first aid. If you don't have a first aid at home, please get one. If you don't have a first aid at the workplace, please get one. Nobody's going to tell you, I'm going to be having a chest bone, or I'm going to have a muscle pull, I'm going to have a, you know.
What would you use for a muscle pull, though?
Okay, we have, we're just going to do a massage. We have the analgesic.
Oh, you have an analgesic there. Okay, I think this is it here.
Yeah. Yes,
Yeah.
we have it there.
Okay,
We also have burnouts.
Oh,
so
nice. You're fully ready, prepared.
I move
for the
around with
battlefield.
it. Yes.
You even move around with it.
Yes, it's always in my car.
So, Bukola Essien, as I mentioned earlier, provides emergency services for events, and I find it really commendable that everything is thought out. Of course, you have the science background, the medical
Yes, I
background,
do.
so that also helps with making what is supposed to be in, and also having the foresight to be prepared. Thank you so much for your time, Bukola. It's been an interesting 5 weeks
Oh, yes.
of having this conversation, especially on the importance of emergency services at events. Thank you so much indeed.
You're welcome.
And to reward you, we had breakfast.
Oh,
She's been coming all this while, so you'll have breakfast with us this
Oh,
morning.
that's
so we're
nice.
heading to the kitchen right
all
now.
right then.
The guys are waiting.
All
Let's
right.
go join them.
Okay.